The revelation that a commonly prescribed medication can lead to compulsive, reckless, and even dangerous sexual behavior is both shocking and deeply troubling. A new BBC investigation has exposed the dark side of dopamine agonist drugs, medications taken by millions of Americans for conditions like restless leg syndrome, RLS, and Parkinson's disease, revealing that pharmaceutical companies have known about these disturbing side effects for over 2 decades but failed to properly warn the public. The consequences have been devastating for many patients, some of whom engaged in extreme and life-altering behaviors they would never have considered before taking the medication. Dopamine agonists work by stimulating dopamine receptors in the brain, mimicking the effects of the neurotransmitter responsible for pleasure, reward, and motivation. While this mechanism makes them effective in treating movement disorders, it also makes them highly susceptible to triggering compulsive behaviors. Over the years, these drugs have been linked to a range of impulse control disorders, including gambling addiction, shopping sprees, binge eating, and hypersexuality. However, the latest findings suggest that in some cases, the changes in sexual behavior go far beyond increased libido, leading to reckless, dangerous, and even criminal activity. One of the most harrowing accounts comes from Claire, a woman who was prescribed dopamine agonists for RLS. Before taking the medication, she led a stable life, but soon after starting treatment, she found herself experiencing overwhelming and uncontrollable sexual urges. She began dressing provocatively and seeking out encounters in unsafe situations, often late at night, disregarding any concerns for her personal safety. The moment she stopped taking the drug, the compulsions disappeared completely, leaving her horrified by the extent to which her behavior had been altered. Claire is not alone. The BBC report included testimony from 20 women who experienced similar effects, many of whom suffered profound personal consequences. Marriages fell apart, relationships were destroyed, and some even put themselves in harm's way, all without realizing that their medication was the driving force behind their actions. Some individuals reported engaging in risky online interactions, while others described compulsions that led them into financial ruin, spending thousands of dollars on adult services or gambling away their life savings. Perhaps even more alarming is the fact that pharmaceutical companies have known about these risks for years. Internal documents from GlaxoSmithKline, GSK, one of the major manufacturers of dopamine agonists, show that the company was aware of the link between the drugs and extreme sexual behavior as early as 2003. In one particularly disturbing case cited in the report, a man taking dopamine agonists for Parkinson's disease was documented to have sexually assaulted a child while under the drug's influence. Despite these findings, warnings on patient information leaflets remain vague and downplay the severity of the risks. While labels may mention increased libido or compulsive behaviors, they fail to convey the life-altering impact these drugs can have on unsuspecting users. Regulatory agencies, including the UK's Medicines and Healthcare Products Regulatory Agency, MHRA, and the US Food and Drug Administration, FDA, have been slow to act despite mounting evidence. While some countries have updated warning labels to include risks of impulse control disorders, these warnings often do not go far enough in explaining the potential severity of the effects. Many doctors are unaware of the full extent of these risks and therefore fail to properly inform their patients. This lack of transparency leaves many individuals unknowingly exposed to serious and irreversible consequences. The pharmaceutical industry's failure to take responsibility for these side effects raises significant ethical questions. Why were these dangers not made clearer to patients from the outset? Why did companies wait years to acknowledge what their own internal research had already confirmed? And how many more people have to suffer before real action is taken? The reality is that the financial interests of pharmaceutical companies often take precedence over patient safety. Acknowledging severe side effects can lead to lawsuits, damaged reputations, and lost profits. In many cases, companies have chosen to minimize or obscure risks rather than confront them head-on. The lack of accountability is particularly concerning given that these drugs are prescribed for non-life-threatening conditions. Unlike chemotherapy or critical heart medications, which may require patients to accept severe side effects as a trade-off for survival, dopamine agonists are used to treat disorders like RLS, which, while uncomfortable, are not fatal. Patients deserve to have full knowledge of the potential consequences before making decisions about their treatment. If many of these individuals had been properly informed, they might have chosen alternative therapies or monitored their behavior more closely for warning signs. There is also the question of how many lives have been damaged without anyone realizing the true cause. How many divorces, financial disasters, or criminal acts were driven by an unsuspecting patient taking a prescribed medication. Given that dopamine agonists are used to treat millions of people worldwide, the true scope of the problem could be far larger than reported. Many individuals who experience compulsive behaviors may have never connected their actions to their medication, instead blaming themselves for choices that, in reality, were chemically induced. Medical professionals and regulators must take immediate steps to address this issue. First, warning labels must be made clearer and more explicit, ensuring that patients fully understand the risks before beginning treatment. Second, doctors need better education on the side effects of dopamine agonists so they can monitor patients more closely and offer alternative treatment options when necessary. Third, pharmaceutical companies should be held accountable for their failure to provide adequate warnings, with stronger legal and financial consequences for companies that knowingly withhold critical information. The case of dopamine agonists is a disturbing example of what happens when pharmaceutical companies prioritize profits over patient safety. It serves as a stark reminder that even medications prescribed by doctors and approved by regulatory agencies can carry unexpected dangers. The stories of Claire and others like her should not be ignored. They are a warning of what can happen when transparency is sacrificed for corporate gain. Until the medical community and regulatory bodies take meaningful action, countless more individuals remain at risk of having their lives derailed by a prescription drug they were told was safe.